fit into that one particular story. Hence the need to bring the doctor himself right here in the studio. Thank you very much for creating time for us.
Our pleasure.
And yes, now someone is watching, they have not even understood what plastic surgery is from this story. Now, can you just give it a more explanation?
So in simple terms, plastic surgery is where you want to restore form, function, and cosmesis. So what you want to do, if someone has lost part of their body, you want to restore like with like. So you want to get a tissue that resembles whatever has been lost, or something that is very close to what has been lost, so that you can achieve function. In the same way, in the same sitting, you achieve some form of beautification or cosmesis, in a nutshell. Yeah.
So while growing up, did you just want to be a surgeon, or what really informed your decision to be a surgeon?
Two things. I wanted to be a pilot or a doctor. Yeah. Then when I went to high school, we had aviation club. Then I think after that, then I decided, no, let me just go to medicine.
So it was actually something you decided on while still young.
Yeah.
Now, how has it been used in the health sector? Give us the side where it has been used for beauty purpose and also as a health in the health sector.
Yeah, plastic surgery is both what we say reconstructive arm and the cosmetic arm. Yes. Equally important, because when those patients who do cosmetic surgery, they are psychologically disturbed with their problem, like the lady that you presented there. So majority of patients, you see, they have burns, so you have to reconstruct, you have to give them the skin, you have to remove contracture so that they can use their hands, their neck, you have to release. Some of them would have, after road traffic accident, they have lost tissue, they have exposed maybe bones. You have to get what we call flaps, tissue from one side of the body transfer to cover that, so they'll be able to walk and use that part of the body, the limb, lower limb, or upper limb. Yeah.
So about the beauty, using it for beauty purposes.
Yeah, using it for beauty purposes for many applications. For example, you have people who are public figures. For example, like you are news anchor.
They want to remain the same.
They want to remain the same so that they can either prolong their career or can advance in their career. Or they can just want to feel good about themselves so that they can improve their self-confidence, which is allowed. Yeah.
So do you think in any way can be dangerous to one's health?
It depends on what you're using. If you're using natural products, most of the time it's safe. But now if you use chemicals and other products that are not approved, then it's dangerous, can lead to health hazard. That being said, plastic surgery is like any other surgery that comes with the complication of surgery, complication of anesthesia, infection, and whatnot.
Okay. Yeah. So there is no 100% guarantee that?
In medicine, even taking Panadol is not 100% guarantee.
Oh, right.
Any drug that you're taking has side effects and it can go either way, can have adverse reactions. Yeah.
Now, do you think the government has really done enough in the surgery sector, or what can really the government do to enhance the operations of the surgery sector?
My opinion is actually, I think as a country, we have to pull together. You cannot just say the government. So for me, my challenge is to everyone. Yes. For example, in healthcare, we are doctors there who are at the end. But you also have people in the industries, and most of the equipment that we use, we have to come together. We design instruments and consumables that are used for our local people, so that we can reduce the cost of the cost of consumable down, and overall the cost of healthcare. So I'll challenge, even like this is a university and any other institution, you have to do research, and from the research you have to come up with products that is going to make sure we achieve the universal health coverage by reducing the cost. That will be my challenge. The government will only come through legislation, promote training, or maybe research funding. But as young people, for me it's a challenge for our generation. We have to think of how we can do, because it's a service. Healthcare is a service. But how can we serve the
Do you think that we are really equipped, as especially this young generation, do you think we are really equipped to do all that by ourselves?
I think we are. I'm an optimist. I think Kenyans are brilliant, and it's about pulling together. And if you have an idea, what I believe, if you have a good idea, you'll get funding. And that should be the positive attitude. If you have an idea, good idea, you will get funding. Yeah, so all this spectrum, there's a lot of opportunities. For example, the future of medicine is in stem cells, gene therapy, and there's going to be targeted therapy. Now, that means you have to shift our thinking from consumers of research and development from other countries to producers of knowledge and treatment options. Yeah.
Now, take us through the surgical procedures from the head to the toe. What can we do on the head? What can we do to the stomach? What can we do to the legs? What are the procedures that are available?
From head, as I said, is hair transplant, which is a surgical procedure. Or you can do hair restoration, non-surgical, like the PRP injection. You can inject stem cells on your hair. Some people after burn injury, they have scars. You can do scar reduction. About a little bit of procedures. You can do tissue expansion and flap rotation. Yeah. Now, when you go to the face from the forehead...
Wait, still on the hair.
Yes.
Someone may be asking what causes the loss of hair most of the times.
No, there are two categories in male and female. In male, typically you get male pattern, straightforward. Yes. And there are different classification, but it's male pattern due to testosterone, dihydrotestosterone, the male hormones. So because of the activity of the male hormones, they act on the hair follicles, they thin and they fall off. Before even you get to transplant, so we can give you some spray cream to try and reverse that. So if it's advanced, then you have to go and do hair transplant. Okay. And hair transplant is like you're planting trees. So you just pluck one by one. You
pluck from
the back, the back of your head to most of the time anteriorly, front of your head. And then there's a way you arrange them in patterns. You achieve that frame. Yeah. For female, it's not straightforward because you can have other issues. You can have what we call systemic illnesses, or you can have...
what are the systemic illnesses?
For example, this autoimmune, you have those illnesses that your body attacks itself. That means it attacks different parts of your tissues, attacks your hair follicles, attacks your skin, for example, SLE, which can manifest with hair loss. There's also some form of hair loss in female that occurs during pregnancy and breastfeeding, but that is transient, meaning after that period, their hair will grow back. Yeah.
Take us to the face now.
Now, the face from forehead, you do brow lift. You can do facial rejuvenation. You can remove the lines using Botox or fillers. Then your eyebrow, you lift.
The eyebrows get lifted?
Yes. For example, with aging, what you do, you get sagging of the upper eyelid. So with that one, you can either do a lift. You can cut part of that excess skin, and you hide it. In that there's a line in your head, you can't tell. And then your lower eyelid, also a bit of procedures. And then you have what we call crowfits. You can do Botox, fillers, go to the nose, a lot of procedure, rhinoplasty. Which
can be made longer or shorter?
Yeah, longer, shorter. There are people who have a bulbous nose, you want to narrow it. People who have flooding of ala, so you want to reduce it. You want to make it project, not to flatten. Yeah. And then there's this fold, they call the solabia folds, which you'd want to blunt them so they become youthful. And then the cheek, you would want to, a prominent cheek is a youthful cheek. So you can either put a cheek implant, or you do fat, or you do a facelift. Then the lips, you would want your lips to be prominent and to be supple. So you do fillers, you do fat, and you can do reduction of the lips. And then chin, you can also do a genioplasty, whereby you put an implant to make your chin prominent. And then you do beard transplant for some men who want full beard.
You even do beard transplant?
Yeah.
All right.
And then neck lift,
Neck?
Yeah.
Mid-long?
No, you want to remove the wrinkles.
Oh, all right.
Yeah, or you want to make it supple, so you either cut it or you do fat transplant, stem cells.
Now, moving on swiftly to the stomach, many of us have a problem where even if you go to the gym, there must be that segment that really can't really go away. How can it be solved?
If it depends with the body habit. If it's just a small tummy, you are working out, you just have a small amount of fat that you want to get rid of, simple liposuction will do that. You remove the lower part of your tummy and the sides, the love handles. But now, if it's too much, then you have to do what you call abdominoplasty, which can be standard abdominoplasty, or you combine abdominoplasty with lipo. So we call lipo-abdominoplasty. Yes. So this
whole procedure uses, it's the fat that is being utilized. How does it work?
What you do, it depends. It can either be ultrasound-assisted liposuction, can be water-assisted, water jet-assisted, or mechanical. But the whole principle is you want to harvest the fat in a safely without damaging the nerves or the blood vessels. Then you process that fat into gel with a high concentration of stem cells, and then you inject the aliquots of fat. It's like you're planting, because they're cells. You also do like you're planting so that they can take. Once they take, then they can give you the form. But for all that we say is a body contouring. Basically, is an art. It's like you're doing sculpturing using clay.
All right.
Yeah.
So, can you use somebody else's fat if you don't have to improve your own body? Can it work?
Unfortunately, you can't, because the
What
same
are the
thing.
repercussions?
HLA matching, the same way you can't take kidney from any other patient unless it's your relative, unless you do matching.
Okay.
Because your body will react. Your body is going to reject. I'm sure you've heard of rejection of donor site and whatnot, donor organs. So you really can't. However, in the gene therapy with...
Even if it's relative?
Even, no one has done that,
Okay.
really, because you have to do a lot of typing
All right.
at the cellular level. And for you to transfer a huge amount of fat, do all that typing, there will be a high risk of rejection. Besides that, it doesn't make sense for you to take fat from somebody for cosmetic surgery and then you have to put on your immunosuppressants. Because someone who's to receive an organ, you have to suppress the immunity so that it doesn't reject.
Okay.
So if you look at the cost benefit, it doesn't, it's not safe, really.
Now, you've just spoken about the organ transfer. Does it happen in Kenya? Or if not, why?
What we have in Kenya, we do kidney transplant, is a commonplace. We've done mostly corneal transplant. However, there are some area which you really want to get into, and other professions, not really in plastic surgery, like gastro and the hepatobiliary surgeons want to get into liver transplant. I'm sure you've heard we did the penile implantation, but now we want to go a step further and do penile transplantation.
Is it allowed by the Kenyan government?
It's silent. That's the problem. So you want to put mechanism and put law. And you know, from our culture, many people do not give their body. You see, so you have that challenge. So you have to do education, people to be able to give up their body, and so that you'll be able to harvest. And there has to be legislation of how you're going to handle that safely, so that you don't have organ harvesting.
Can you make clear what it means to give out your body? Because I believe nobody would like to just give up, say, now kill me, make the other one alive.
No, not necessarily like that. Like now for teaching, like here at University of Nairobi, we use cadavers, use the body for teaching, which people have either given up, they have written a will that once I die, I want my body to be used for advancement of medicine, or unclaimed bodies. Now, the challenge with organ, you need to get an organ that is viable. That means you have to get the organ while the heart is beating, the blood is... So an ideal candidate will be someone who is brain dead. Someone maybe who unfortunately has been involved in a road traffic accident. The brain is dead, but the heart is still pumping. So you have to act very fast and get the organs, preserve them, and then give to another person.
So it has to be a very swift action.
Yes. That's why there has to be legislation and controls. Otherwise, it will be abused.
So some argue that this is Kenya, and when this law that you are saying is still in court or rather in parliament, it has not been decided upon. When it is allowed, this is Kenya, people will start killing others just to get the body organs to go and sell.
I don't think so, because the way the legislation is being planned right now, and we have very good support from the ministry, both from the AG office and the Ministry of Health, is that it will be a government agency run by government, not a private entity. And in other countries, there is usually a list with matching. So it's not free for all. You don't buy, but it's free will. There's no, actually, it's a ban on trade of organs. It's on voluntary basis and matching.
All right. So which kind of organs can really be transplanted if that goes through?
Penile, you can do liver, we can do eyeball for now. However, let me add where the technology is right now. I'm sure you've had 3D printing and with stem cells. So where the technology is worldwide is that we want to get to a place whereby you can 3D print organs. And that will actually solve this issue.
Do you think that can be done right within the country?
This actually, if you've read around the separation of twins, siamese twins, we use a 3D model to do that. But that was a plastic model. So there's that technology of 3D printing. But now bioprinting is where you have to get into, and where the bottleneck right now worldwide is that you can 3D print a solid organ, but the issue is now getting blood vessels into those organs. And there's a lot of research into that area. So if it maybe in our lifetime we can get organs being 3D printed, we get your stem cells, we 3D for you, 3D print for you a spare part heart and give you.
Spare part heart?
Yes, hopefully.
Right, so that when I lose mine, I get another one?
Yeah, from your stem cells.
Oh,
yeah, hopefully. Yeah.
So like you have a reservoir somewhere?
Yes, yes.
All right. Now, something else about chemical use.
Yeah.
Just give us an advice from the doctor's perspective. The use of pills, the use of creams to change the body color.
You know, there's, how can I put it? Chemicals are not good for you, especially there's people call Koroga thing and whatnot. Yeah. You know what it does? Number one, there are very different many chemicals in that, and those chemicals can actually cause skin cancer. And some of those chemicals get rid of your melanin. Melanin is good because it protects you from harmful rays, sun rays. So it also predisposes you to cancer. And then some of them thin your skin, so that if you do surgery or you get injured, then it becomes very, very difficult for you to repair that part of your body. So if you want to do, there are actually medical ways of lightening your skin, which are safe. Or doing those cosmetic things that are safe, that are going to be safe for you.
You have a procedure where someone's skin color can be changed, but it is safe?
I don't do it, but they are there. Oh. They're there, yes.
Okay. Yeah. So in this particular usage of chemical, now someone has used the chemical, and then maybe they get involved in an accident, they come for surgery. How does it go?
It's difficult, even when you do some of this surgery, tummy tuck, breast reduction, because you see, the people who do cosmetic surgery have the same profile, because they always want to improve their appearance. So if they come, we do some of those conventional plastic surgery procedures, and they have used chemicals to thin their skin, and it becomes very difficult for you to achieve healing, or you have high complication rate. So I'd really discourage that. If you want to do something in your body, get someone who is qualified to do it for you. And our push and our thinking as the Society of Plastic Surgeons in this Kenya Society of Plastic Surgeons, is to try and give high quality of service at a reduced rate. Because I know people have this notion that plastic surgery is very expensive, but because we had to go outside. But right now we have at least locally.
So is it quite affordable?
It's affordable. It is affordable, yeah.
Like what range, or that one you have to?
It depends the procedure, but can range from 50,000 to $1 million
and
plus.
Once plastic surgery has been done, maybe it has been done today.
Yeah.
How long can it take just to maintain that particular look?
One. No.
Or how regular should you continue doing it?
No, it's not necessarily. There are people who just do one procedure, it changes their life forever.
Okay.
Like you do liposuction, lunchtime lipo, you do, next day you're up, you go back to work, and then you maintain healthy lifestyle, you maintain your body. So it's about your discipline as a person and how your routine has been. Awesome. So you just use plastic surgery just as icing, but not as a weight loss program or so.
Wow, as we wrap up, your last word.
For me, I'll encourage young people of this country to take up the challenge and be the future drivers of this country. There's a lot of opportunity for young people. And I know sometimes usually you say you're young, there's nothing you can do, but there's a lot that we can do. With the internet, with all this technology outside there, just have need to push the ceiling and really change this country for the better.
Thank you very much, Dr. Ajujo,
Thank you.
for gracing our studio.
Thank you.
It has been a pleasure to have you. Well, that is Dr. Martin Ajujo from the University of Nairobi discussing plastic surgery. There you have it, as young people.